Well, you're most welcome to today's update. It is Wednesday the 9th of June. News primarily from the United States and the UK today. Let's start off with the United States. Let's have a quick look at the orientation screens first of all. Cases going down really quite well in the United States. Quite a satisfying reduction in cases. And if we have a look at the deaths as well in the States, daily deaths in the States, and again we see a continued reduction, although the reduction has been slow. The issue in the States really at the moment is the reduction in vaccinations. Now these numbers look good, 51.7% of the whole population with one dose, 42.3% with two doses, but the problem is 140.4 million fully vaccinated. Always a day or two out of date, of course, from the CDC website, but the problem is the rate of vaccination is much slower than we would like. And the reason it's a concern is the India Delta variant. So particularly the B1617.2 variant in the United States. Now, new data from the UK on this is not particularly good, as we'll see. Basically, this variant is twice as transmissible as the original variant. So the B117 UK Kent Alpha variant, about 40% more transmissible than the original variant. This about another 40 or 50% on top of that. So basically, there's 100%, twice as transmissible as the original variant. And this is an issue, and it's increasing in the States. Now, it seems that, you know, for a long time, me and a lot of other people have been talking about herd immunity levels. But this has turned out to be a bit simplistic. So you could have herd immunity in one age group, for example, one demographic, but not have herd immunity in another age group. And this is what we're seeing. 20 to 30-year-olds, the main area of increase in the UK at the moment. Those that are just starting to be eligible for vaccination now, as well as in secondary school age children. So twice as transmissible. So this could be carrying on in certain areas particularly. And very often young people get very mild symptoms. They might just think it's a cold. So they could go out, they go to a party, and because the R value of this is probably double what the original variant was, it could be 6. So they're infecting 6 other people potentially, and that's 6, another 6 each. This is why it's an issue. So May the 8th, data from the United States, still not particularly good on this. Have a rat around these sites, but this is the best I could find. May the 8th, 3% was the Delta variant, the India Delta variant. Now it's 6% at least, so you can see it's doubled. So there's an exponential growth potentially in this variant, despite the fact that cases overall are going down. In other words, this new variant is becoming a much higher proportion of the overall cases, and it is still possible that this will become the predominant variant in the United States for this hopefully last part of the pandemic, but with the lower vaccination numbers in the States, it is still an issue. So 40% more transmissible than UK Alpha B117 variant, 2 times as transmissible as the original one. Now, the thing about the vaccines is they do protect, but one vaccine dose is only giving about 33% protection. For the UK Kent variant, it was much higher. It was 50% protection. So some protection after one dose of vaccine, but not much. Not much. Now, this is data from the UK on the Pfizer-BioNTech and the AstraZeneca. So this is UK extrapolated data. I do not have any data for the Janssen single-dose vaccine on this yet, because we're not. It's not being significantly rolled out in Europe at the moment, so we don't really know what's happening with that. In terms of the new variants and the spread in the United States. We expect it to be fairly good. I was expected to be comparable with the Oxford AstraZeneca vaccine, but we don't know that for sure. But the Pfizer-BioNTech and the Oxford AstraZeneca vaccine in the UK data are 88% effective at preventing symptomatic disease caused by the India Delta variant. So you can see it goes up from 33% protection after one dose to 88% protection after 2 doses. This is why the big emphasis at the moment is on 2 doses, because the UK, the India Delta variant is now the predominant variant in the UK, and we need 2 doses to protect against it. And it will be the same for the India variant, the Delta variant, I strongly suspect, in the United States. Moderna is probably similar to the Pfizer-BioNTech because it's another mRNA vaccine, and as we said, the Janssen is probably similar to the AstraZeneca, being an adenovirus vector vaccine. Now, the aim is to get 70% of adults vaccinated by the 4th of July in the States. Currently, it's 63.8%, and the current trajectory will get to 67%. So it looks like President Biden, the way things are going, is not going to reach that 70% by the 4th of July, which would be a real pity. Now, I was watching an American news outlet earlier today, and I was a bit taken aback, really. They're having incentives, so burgers, donuts, beers, lottery tickets being used as an incentive. Now, this one takes the biscuit. Washington State, they're actually giving out legalised cannabis for people to smoke as an incentive to take the vaccine. I mean, Washington State officials, what are you thinking? What impression is this giving to the rest of the world who are clamouring for vaccines to save lives? Really, I mean, think about what you're projecting to the rest of the world here. It really is giving out cannabis as an incentive for vaccination. Let me know what you think of that. Personally, I don't think it's dignified, and that's putting it fairly mildly. California are giving away lottery tickets, probably not the most dignified thing either. West Virginia apparently are auctioning trucks and guns. Is this true? According to that outlet, let me know if that's true. I mean, that was just the media outlet. I think that was NBC Nightly News I got that one from. So, yeah, okay, leave that there. 2 doses necessary. Now, in the UK, again, the big problem is the outbreak of the Delta variant, the India variant. Quick look for orientation at the UK. So the vaccinations are going well, but this is only the adult population, of course, not the entire population. But unfortunately, we do see that cases have gone up quite dramatically in the past week. Hospitalizations are actually up a little bit. It doesn't really show on this. Cases now, we're still at a low level, but it doesn't look much on there. But this could actually be the start of a third wave because of the immense transmissibility of the India variant. Now, just listen to Tim Spector. The R value according to the COVID symptom study app is currently 1.3 in the UK. Now, as we remember from earlier parts of the epidemic, this represents exponential growth. So it's on a low number. It's on a low number of cases, but it's growing exponentially. Therefore, it can double and double and double. And you know that story. London, apparently, is 1.8 in places. But remember, the intrinsic R value of the new India variant may well be 6, unmodified. So if we don't modify this, it's going to spread rapidly through susceptible populations that don't yet have 2 vaccines. This is actually the most concerning time in the UK for some time, actually, with this new variant. Now, just other things. Portugal is now gone onto the amber list, probably just as well, because Portugal needs protected from the Delta variant. That's not why we've done it, of course, but that's a good side effect of that. But of course, it's caused a lot of disruption. Manchester and areas of Lancashire surge testing and vaccination. So military have been brought in to coordinate logistics. Now, the military logistics on this are usually excellent. So they will be coordinating the vaccination programme and the mass testing. But of course, the mass testing is only as good as people complying with the isolation if they test positive. These areas in Manchester and Lancashire are areas where there's a lot of multi-generational households and where there has been travel from the Indian subcontinent as well to bring the India variant in. It's a pity we didn't stop flights from India when I first suggested it on this channel, then we wouldn't have the problem. But there again, we suggested stopping flights from China back in late January, early February 2020. But there you go, that's the past now, but it is a pity. Basically, I think the UK Delta variant is a bit of a threat to many countries at the moment. So if I was in Europe, I would want to restrict travel from the UK, that is for sure, and certainly from the United States, if the United States authorities wanted to do that. So this is working to some extent. Now, it worked to some extent in Bolton. Cases are down about 25% on the week. So 25% reduction on the week. I'd say it's starting to work rather than it's working. Now, the government have said that they're continuing to follow the joint board of the Joint Committee for Vaccination and Immunisation guidelines on vaccinating the oldest and the most vulnerable first. We're going by age groups, so there is not at the moment a surge of vaccines going to these areas, but I believe they're making sure there's enough vaccines in place to vaccinate those that are eligible. Government says the race between jabs and variants is growing tighter. Well, that's true. Announcement on Monday, of course, about the 21st of June for more opening up. Right, 25 to 29-year-olds from yesterday are getting texts to get vaccinated, at least in England. And the other countries won't be far behind. The devolved administrations won't be far behind. So we're actually vaccinating people in their late 20s now in England, which is good. Matt Hancock in the Delta variant, it's 40% more transmissible, he's saying. Now, this is based on the Secretary of Health saying this based on his scientific advisors. Doesn't mean to say we take everything that Matt Hancock says as genuinely automatically true, but he's well advised. So, and that is consistent with what Tim Spector's saying as well. Twice as transmissible as the India variant. Increases in recent weeks, concentrated among secondary school age children and people in their 20s who are not yet vaccinated, as we've said. Often presenting with mild, more common cold type symptoms that they're not recognising as COVID. So basically, especially in younger unvaccinated people, we have to have a high index of suspicion that any of these type of symptoms, more on the symptoms tomorrow, but any of these type of symptoms could be COVID, get tested and isolate if appropriate. We really still depend on people to do this. And this is critical, otherwise there could be a third wave in the UK. It won't be presumably as bad as the past waves because the vaccines will protect from hospitalisations and deaths. But this virus is not finished with us yet, unfortunately. Matt Hancock's formally asked the Joint Committee on Vaccination and Immunisation to produce clinical advice on vaccinating 12 to 17-year-olds. So that should come probably fairly soon. And of course, the Pfizer jab was approved for this age group. So I'm expecting, as in the US, that in the UK we will be vaccinating 12 to 17-year-olds soon. Not quite sure when, but soon. So as of the 3rd of June, a bit dated now, but as of the 3rd of June, 12,383 cases of the Delta variant, according to political announcements, but we believe they're from the scientific advisors. 646 reported for hospital assessment. So 646 of the 12,383 reported for assessment. Of course, the spread is mostly in the younger age group, so there's a much lower morbidity than there was when we didn't have more vulnerable groups protected. 126 people admitted to hospital. Of that 126, 83 unvaccinated altogether. 28 had had one dose of vaccine, but only 3 had had 2 doses of vaccine. So you see there, lack of protection on unvaccinated, some protection with 1 dose, but much more significant with 2 doses. So the importance everywhere of getting 2 doses. Firm data supporting that. Now, just briefly, Office for National Statistics in the UK. These are the prevalence figures, week ending the 29th of May. So 0.16 in England, 1 in 640. Wales, 0.10, 1 in 1,050. Northern Ireland, 0.12%, 1 in 800. And Scotland, 0.15, 1 in 680. So they're the prevalence figures. Were the whole country to be tested in that week, they would be very close to that. And of course, now the Delta India variant most common. Infections and deaths. So deaths, most deaths no longer among those aged 75 and over, which is good. But the actual main deaths in that week were in the 65 to 75-year-old age group. So the age group that were vaccinated, but that was still the main number of deaths. But the number of deaths fairly low. England and Wales total deaths are actually below the 5-year average. We've actually got a graphic of that. So here we see that. So we can see the average death line is there. And here we see the deaths from the second wave. Blue deaths are COVID deaths, of course. Here we see the deaths from the first wave. Green are all deaths. And this is the typical number of deaths line here that you would expect to see in those weeks of the year. So we see excess deaths from COVID here. That's back in March 2020. And of course, excess deaths in the first part of 2021 and the last part of 2020. But now actually slightly below the 5-year average. So COVID deaths in the week ending the 28th of May, there was 95 COVID deaths, 12 down from the week before. But with the increase in cases, despite the protection of antibodies, I am expecting deaths to go up a little bit in the next few weeks, perhaps to the region of about 40 deaths per day is possible, unfortunately, in about a month's time. Nothing like where we were, but worse than where we are now, quite significantly worse than where we are now. Antibody positivity. Now, this is a bit of a complicated story. Week ending the 22nd of May. In England, 80.3 would have tested positive. Wales, 82.7. Northern Ireland, 79.9. Scotland, 72.6. Highest amongst the older age groups, of course, that were vaccinated first. So that's antibody positivity testing. Now, this looks good, 8%. But a lot of that 80% are given their protection after the first dose. That's why at the moment we're giving more second doses than first doses in the UK as of this week. So although the antibody levels are 80% there, if a lot of those are due to the first dose, that's not going to give as much protection against the India variant, which is now the most prevalent common variant. So not quite as good as it looks, but that's the people that would test positive for antibodies. Now, quite a lot of people, as we've seen, had the infection in the first and second wave. Now, the people that had infection in the first wave, the antibodies will have gone. They won't be detectable anymore. It's a year ago now. But they will have the T cells, the memory T cells and the memory B cells. So they will have, we believe, a fairly large degree of immunity. So the figures aren't as good as they look because a lot are caused by people having one vaccine, and that's not going to give high levels of protection. But we can probably add about 10% onto that from people that were naturally infected in the previous waves who will still have memory B and T cell immunity and will quickly mobilise and produce huge amounts of antibodies if they were challenged to secondary or to a reinfection. So that sort of puts a bit of context on that. Long-term immunity I remain optimistic about. Now, just briefly, Spain, open to fully vaccinated visitors. You see, the people that had to come back from Portugal, it was just everyone. There was everyone who wanted to avoid the 5 days minimum isolation, assuming they had a negative test. But there was no mention of vaccination status. In the UK, this is being ignored. But in Spain, they're not ignoring it. Open to fully vaccinated visitors, except Brazil, India, South Africa. I would suggest they add the UK to that as well at the moment because of the relatively high prevalence of India variant, particularly in younger people. They're going to have official certificates, visited, vaccinated at least 14 days. In other words, fully vaccinated people that have had 14 days since the second vaccine. Or people that have had COVID infection in the last 6 months, indicating they think that the infection is going to provide equivalent immunity to vaccination. Ideally, people would have at least one dose of vaccine some months after they were naturally infected. The vaccines accepted are those accepted by the European Union and those accepted by the World Health Organization. That's interesting. So I expected the European Medicines Agency one, the Pfizer, the Moderna, the AstraZeneca, Johnson & Johnson. But they're also accepting those approved by the WHO, Sinopharm and Sinovac. Interesting. That's the Spanish decision. I'm not saying it's right or wrong. It's probably quite reasonable. It's just a big change. It's just a big change on the previous European position. European Union, we're going to have green digital certificates coming soon, but of course they haven't got the act together on that yet, but they're coming. Portugal's still on the amber list, but probably as well to protect Portugal from us. Now, these cases in Manchester and Lancashire, where there's these surge testing at the moment, the only strategy being used is non-pharmaceutical interventions and vaccination. They're the only things we're being used. I therefore, as I've done before, call on the government to publicly announce if vitamin D is useful and if ivermectin is useful as a short-term measure to prevent spread. I think the evidence from vitamin D we've looked at numerous times is there. I think it's there. I think the government advisor should speak to that. They don't. They keep perfectly silent about it. I can't explain that. I think the evidence from India on reduction in cases in many parts of India as a result of ivermectin prophylaxis, I think that evidence is sufficient that the government advisors should give an official permission on that. They don't. They keep completely silent about it. We're supposed to be evidence-based, but those aspects of the evidence-based don't seem to be being considered, even if it is to reject it. So mystifying, deafening silence on those two topics from the UK authorities. And I don't know why that is. Right, now, Dr. Nigel Farrier in Australia has kind of done as his take on the new variant descriptions. Now, to tell you the truth, I haven't watched this, so I'm going to watch it with you, and we should find it interesting. Nigel's talks are always well informed. So let's go on to Nigel now. Nigel, thank you for sending these, of course, and I'm as curious as you to know what he's going to say.
So, hello. I thought I'd do a little bit of a little instructional video on the recent classification from WHO on the variants of concern and variants of interest, and also something on the side effects of the COVID vaccinations, because there seems to be an awful lot of confusion going around regarding those. So with the variants of concern, the new classification doesn't involve numbers B117, etc., or where the variant originated, such as UK, Kent, or South Africa, or India, Brazil, etc. So they've gone and started to use the Greek alphabet letters. So I'll just try and go through them slowly. So the alpha, that used to be B117 from the UK, but it's now called alpha. Beta used to be the B1351 from South Africa. Delta is the B1617.2, which is from India, and I think that's the main one causing troubles around the world at the moment. And Gamma, which was P1 from Brazil. So those are the main variants of concern. The following are all the variants of interest that still have not been classified variants of concern. And they are Kappa, which is the B16171 from India, not 2, that's Delta. Epsilon, which is the B1427 and 429 that I think originated in the United States. Zeta, which is the P2 variant from Brazil. Eta, or Eta, B1525, that originated in quite a few different countries. Theta, which is the P3, which came from the Philippines, I think, originally. And Iota, the B1526, which came from the USA. So that's the new classification, and I think you'll be hearing that a lot more now, and I think mostly it'll be regarding Delta, which is the B1617.2 from India. as that is the one causing problems around the world. So I hope that was useful. So, hello. I thought...
Quite impressive getting all those right, Nigel. At least as far as I'm aware, you got them all right. So hope that helped. Thank you very much. And thank you for watching today.